Rape is sex without consent and is done mainly by force. It can be with a stranger or with someone you know. For example, date rape, domestic or intimate partner violence. It can happen. All forms of sexual assault are crimes. Even if the victim is drunk or taking drugs or unconscious, it's still a crime. Each state has their own way of defining rape. Sometimes they call it aggravated sexual assault. Um, that includes homosexual rape, incest, and other sexual offense in that definition of rape. There's also statutory rape, which is intercourse with consent, but the partner is too young to be able to legally consent. For example, that's a male who's 25 who has sex with a 13-year-old girl. Rape mostly is motivated by extreme anger or the need to overpower the victim. Violence is not always involved. Forced sex is intended to abuse, humiliate, and dehumanize the victim. There are many different effects of rape, both physically and psychologically. They can include injuries from being abused, from beating and choking, such as bruises, scratches, cuts, and any other broken bones. The genital area can be swollen. There could be bruising around the vagina. There could be any injury to the rectal, vaginal area, any tearing of the tissue that connects the anus to the vagina. You could get sexually transmitted disease, and you could possibly become pregnant. Some of the psychological effects for rape victims include severe anxiety, depression, having a difficult time concentrating or falling asleep. You continuously dream about what's happened to you. You have inappropriate gut feelings. You emotionally feel numb or irritable. You have flashbacks about what happened. You have nightmares, or you just have extreme fear. Those are all effects of rape. If you are raped, you need to preserve any evidence of what has happened. Don't bathe, don't comb or clean any part of your body, don't brush your teeth or change your clothes if you can. If a date rape drug was used, try not to urinate before you get examined. Don't touch or change anything in the scene. It's now a crime scene. Write down all of the details that you can remember about the attack and the rapist. Call the police to report the incident and then go to the hospital. The doctor will give you a physical exam. They'll give you a pelvic exam and see all the injuries that you could possibly have. The doctor will make note of any of the cuts and bruises you have, especially in the genital area. In your area, they might offer rape victim support services. They're usually available for 24 hours, and they'll usually send someone to go with you to talk to the police or to the emergency room, and they'll help you find counseling afterwards. The doctor will look for any specimen to collect any evidence. They'll look for torn clothing, blood, or any strands of hair that can be related and traced back to the attacker. They'll test them against the body fluid or skin samples from the suspects. After your examination, the doctor might recommend you seek professional crisis counseling. They might recommend that you take any antibiotic for sexually transmitted diseases, such as gonorrhea, chlamydia, or for pubic lice. They might want you to find out about the resources that are available to you to help you deal with the emotional effects of sexual assault. They might suggest you join a support group, take medicines to prevent pregnancy, or to seek counseling about any alternative pregnancy results. A child needs to be evaluated by a doctor immediately. It's recommended that the child see a professional who is trained to work with abused children. The physical effects of rape can last from a day to a few months, depending on how bad the injuries are. However, the mental and the emotional effects are not as predictable. They can last up to a lifetime. They suggest that you go take to crisis counseling and rape support groups to help reduce the long-term effects, such as feeling isolated, guilt, helplessness, depression, and anxiety. Children are more likely to have long-lasting mental and emotional effects, and they normally will need special counseling and care to help cope with the situation. You should, if you have been raped, you should schedule a follow-up visit to the doctor to make sure all the injuries that have happened are healing properly. The doctor will make sure you're not developing any other complications. You should go and get emotional and psychological support. Contact a hospital, social work, or rape crisis center to find out about the resources that are available near you. A rape support group may benefit you, and you can share your feelings with others who have the same experience as you. Remember that rape is not your fault. Do not isolate yourself. Allow your family members to allow support. There's family counseling programs for members who need help dealing with what has happened and their concerns. For a child, find a counselor who specializes in working with children who have been abused and sexually abused. It might be critical to helping reduce the long-term effects. Ways to prevent rape from happening to someone you love. You can teach your child what to do if a stranger approaches them. Tell them what behavior they need to be aware of, what places or situations to avoid, like alleyways and other dark areas. Avoid carrying large, bulky purses and packages. That makes it hard for you to escape and balance. Avoid wearing high heels and clogs. You know they're fashionable. It's harder for you to get away in dangerous situations. Make sure to keep your home and your car locked and secured. Stay away from any dark, deserted places when alone. Be alert of the strangers when you're alone. Choose your friends wisely. Take a self-defense class. Carry a loud whistle in case something happens. It can attract attention. Carry a self-defense spray such as pepper spray. Those are ways to prevent rape from happening